Palliative care is a special care for persons with serious illness and also their families. Hospice care is a small part of palliative care. Please understand that palliative care is not end of life care, and even hospice care is also not end of life care, which many people talk synonymously. Generally, the care that is provided to persons with serious illness during their last 6 months of life is called hospice care. So, the difference between palliative care and hospice care is that palliative care can start even much earlier, even at the time of diagnosis. And during the course of palliative care, most of the time, patient continues to take disease modifying therapy or even curative therapies. They go hand in hand. But in most of the cases, once the patient's disease advances and he goes into hospice care, generally all these medications, this chemotherapy, all these medications which actually work on the disease itself, they are generally discontinued. They generally do not go together, as against palliative care, where it is possible to take both the treatments, both supportive and also curative. That is the main difference between hospice care and palliative care. But again, don't think that hospice care is not about a facility. It's not that hospice care is provided in a hospice. Hospice care is a approach or a system of medicine which can be delivered at home also. So, it is the type of care that we call hospice care. It is not about the physical structure of hospice. So, to just repeat it again, hospice care can be provided in a hospice, a specialized institution where generally we admit only patients with terminal illness. It can be provided in any other hospital. It can be provided in an old age home. It can be provided in an assisted living facility. It can be also provided in house or home of the patient.